Hi, thank you for coming in.
Nice to meet you.
Nice to meet you too. I'm Josh Schneider with Headache Relief. Here today in regards for Relief RX, the new product that I'm trying to get out in the market. Just new. Here's some information about it.
Thank you.
If you would like that to look over as we go about this today. So if you don't mind, I'm going to start asking you some questions. How many customers do you probably come into your store, daily and throughout the week?
So we serve about 200 people a day, and of those people, I would say maybe 5% are questions regarding migraines or headaches.
And as far as the week, throughout, is that pretty consistent, 200 a day, or does it kind of depend on the week?
It's definitely seasonal based, so you'll see a spike in headaches and migraines during the change in season when you'd see cold and flu allergies.
Mm-hmm.
So more towards the end of the year.
Are there any other current new products like Headache Relief that are out there right now, or that you've heard that are coming to the market?
So there's definitely a lot of long-standing products that have been out, some big names like Excedrin, over the counter, and then obviously your ibuprofens and Aleve. But as far as new products, there are more injections that are coming out, like Emgality. But people are finding a lot of relief with them, but they're irritated about the injection side of things. So.
And is that the first time that they've come out with the injection type things for medication for the headaches?
Not the first, but the Emgality is the most popular one so far that's hit the market.
And is it positive feedback, or is
yeah, so side effects have been pretty limited except for the injection site redness and pain, and so as long as people are okay with the injection side of things, they have gotten good results.
Sure. And why are they looking for new products, new customers or patients? I'm sorry.
Yeah, so it's been a long-standing disease state where we haven't really been able to overall find the best results. People always vary on what they find that help them. So some people might have relief with ibuprofen or Tylenol, but that's more the minute cases. For people who have migraines, those are harder to fix. And sometimes, no matter what product they get, they feel like it minimizes how many migraines per month, but it's still not 100% relief. So they're always looking for that, obviously, as their goal.
Yeah, and are they happy with the new stuff? Currently, actually, what they're currently taking, are they satisfied, or is it just something that they've just been taking, they're kind of used to, and they haven't found that new product yet?
Well, the ultimate goal is just quality of life. So some of those that have those migraines, they're not able to function and carry out their jobs. So those are the ones that are pushing you with questions regarding the new products. The other ones who are just looking for your common over-the-counters are ones that don't have it enough to really have a complaint at this time, other than just wanting that quick and easy fix, and that's more headache relief.
Yeah. And how much capacity do you have in inventory to hold our product right now, do you imagine?
We carry about, I would say, 500 to 600 drugs at our store at all times. That varies a lot based off of supply and demand. So if it's moving off of our shelves quickly, we'll always keep more of that in. But if it's something that we don't see many customers coming in with scripts for it, then we would only order it as a patient needed base.
And what problems do you face with the current headache, migraine relief medications?
I would say side effects. And then also, like I said, with the new ones having the injections, a lot of people are not staying adherent to them, meaning they're not actually keeping up with their doses because they do not like the side effect aspect of things.
And that's because with the needle, and that they do it themselves, or does usually someone
Yeah, well,
else
most people.
Do they do it at the pharmacy, or?
So we're not allowed to administer that at the pharmacy, but some of them can take it to the office visit and see their physician to do it, or others will have a family member do it if they're not comfortable. But obviously, they would rather take a tablet or a nasal spray if they could, as opposed to an injection. And definitely the younger population is against taking the injections.
And that with like regular ibuprofen and stuff like that, you could take that multiple times a day. With the injection, is that just a one time a day thing, or can you do that multiple times?
It's usually actually once a month.
Oh wow, once a month. Okay. And do you think they're they're ready to switch medications? Like, do you think they're ready to move on from that, or I think they really haven't even tested that enough
I
to?
think they're always open for discussion. So if it's something they're not getting 100% relief from, but some relief, and you could show them a product that maybe would not be an injection, or even if it is, you could take it less common, but the results will show that it's even more, powerful per se at relieving those symptoms, then I think they would be willing to try it.
And what will you think will happen if a new product does not get out there on the market and they are not seeing better results from the current medication that they are taking?
I think then that insurance companies would not cover it, and so patients are not going to be paying for it or buying it. A lot of times it's word of mouth how people find things out, or recommendations from doctors, and if they know the results aren't there, no one's going to push it.
Now, are you worried about patients being taken off their medication and then being put back on a new one that they are not used to?
The only thing there is that people will then have side effects that they're not common with, and then they're just not adherent. Anytime changes take place, a lot of people have problems, actually being here and taking it, and then they actually have worsened symptoms, and so we kind of get a little bit leery of changing if they've already had success on a certain one for a long period of time.
And what do you want to see for your patients as far as migraine, headache, like relief wise? What have they been saying lately? I guess over the past months or year.
I obviously just want to see customer satisfaction, their quality of life increase to where they don't have to feel like they have to deal with that burden every single day, and that hinders them, carrying out their daily activities without having to worry about that migraine or headache.
Do you see the same people usually over and over asking these questions, or do you just does that vary?
Well, if it's our patients that we help, once a month, and yes, they'll always ask the questions. But if it's just people coming in and out of the pharmacy just for headaches, then those are all kind of new customers that you only see here or there.
And do you often see new customers just come in one time?
Yeah,
for
absolutely.
asking questions regards to headache, migraine.
Yeah, and it's more headache related, meaning that they don't deal with it very often. So when it does happen, they just want to see what a quick fix is and a recommendation from someone who maybe is more familiar with it.
How do you think patients will respond to my new product? I know it's 20 minutes or less, and that's like a lot of products. It just having it on there, they may not believe that at all, but do you think that patients would be willing to try that, something new?
I think they'd be open to discussion, but they'd want to see information on it that would show that it's safe and that it's been used in a good amount of people effectively, and hear what they had to say about it. And if their doctor actually recommends it or says they've heard good things, then typically they may be more willing to try it.
And do you think most insurance will be able to cover the expense?
If it's new, then most of the time it won't be on the formulary of the insurance, meaning it's not covered. So when that happens, sometimes manufacturers will have those manufacturer coupons, which bring it down for the first time for trial, one-time use at no charge. And then the patient can kind of go from there to see if they're willing to afford it. But I would think if it's brand new to the market, it won't be on the formulary. So what is the cash price?
Right now, we just have a bottle that has 30 tablets, and right now we're selling that for $25.
Per tablet or for the bottle?
That's for the bottle.
Okay.
And that's we look with competitors pricing right now. We do like it right there right now. We don't see any need to increase it or decrease it as of right now, because right now we're just trying to get it out to the customers and get them to know our brand. And so that's basically right now we're just trying to expand, because like I said, we're new and we're just trying to make a name for ourselves right now. Yeah, because we wanna help those people that have those problems. One, especially myself, that's why I came up with this product, because I've had problems in the past, and I know how difficult it can be to go about your day having a headache or a migraine. No matter what you're doing, if you're at work, home, if you're out with your friends, having a headache is not something fun to deal with. So, if any time you can get something quick relief, something that can be in 20 minutes or less, whereas a lot of times people have headaches that can last for hours,
Mm-hmm.
you know, and even after the headache's over, it's almost like a hangover after the headache too, where there's energy is not there and all that, you know. And so that's what we're just trying to put a product out there that will help relieve all of that, and it will help not only, you know, get rid of it, but it's gonna help energize you too, make you feel fresh, that you know you're ready to go about your day. And you know, based on what you've heard today, I mean, does it sound like this would be a product you'd be interested in giving to your patients?
So pending more information, seeing like trials and who it was actually used in and what their results were, and then also side effects and like the other disease states, conditions. And, you know, based off that and hearing what you said, it seems like it could be a product I would recommend.
And do you have any other questions for me today as far as, you know, Relief RX?
Not really today, more or less just hopefully we can follow up with each other and you can send me more information.
All right. Well, thank you very much.
Absolutely.
I appreciate you coming in today.
Yes, thank you so
Thank
much.
you.